So the WHO, World Health Organization, that's the United Nations, and of course the WHO seems to be dominated by the CCP. What could possibly go wrong, right? Well, just recently, they finally passed what we've been warning about now for a few years, and that is the pandemic treaty, the pandemic agreement. Nick Hulscher joins me to talk about that and some excellent testimony by our friend, Dr. Peter McCullough, up on Capitol Hill last week. Nick, welcome back to the broadcast. Thanks for being here.
Thanks for having me.
Let's go right away to this pandemic treaty. You've tweeted about it. WHO pandemic agreement approved by member states, ushering in a dangerous new world health order. Now, thankfully, President Trump got elected. He's removing America from the WHO. But 3 years from now, if he's not there, or which he won't be, I guess, unless he runs again in 2028, and I don't know how they do that. There's a constitution thing there. But if he isn't replaced by someone who has a like-minded worldview on this, America could be added to it. Tell us what's in this that America could eventually find itself rejoining.
Yeah, this treaty is very worrisome for global health. And so under the guise of pandemic preparedness, which is what they call it, this treaty, literally it states in the treaty that it's going to give authorization, it's going to promote the fast track authorization of experimental countermeasures. So that includes these genetic injections, these self-amplifying mRNA injections. And so that's just one part of it. It also promotes the use of what they call combating misinformation. So we know what that means. That means censorship and controlling the narrative. But also it promotes vaccine surveillance systems. And what that means is they will be able to install these centralized vaccine passports when there's another pandemic, which will also again, force people into these experimental countermeasures. So, in other words, they have introduced a new world health order among all these member states of the World Health Organization. It's extraordinarily worrisome, and it's such a good thing that President Trump did sign that executive order to withdraw from the World Health Organization, but it does not take full effect until next year. But regardless, we will not be associated with this for the time being.
Well, that is good news. Now, did any nations vote against it?
I don't think any of them did. I think all of them did vote to adopt it, unfortunately. And that includes Canada.
As soon as they release, of course, Canada. So as soon as they release the next pandemic, you're saying this will include fast-track emergency use authorizations with no built-in safety guarantees. So basically roll out whatever you want. It doesn't matter what it'll do to the people because there's going to be no liability or compensation for vaccine injuries. Then you've got coordination of global pathogen and health data via the WHO run with a surveillance system. Digital infrastructure for tracking and compliance. That's your digital COVID passports or your digital vaccine passports. So again, you don't get so-called vaccines, wherever they roll out, forget traveling. You may not be able to go into restaurants. You may not be able to go to churches. You may not be able to go into big venues for concerts. Basically, it's you're being shut out of the entire civilized world, right? You're just going to sit at home by yourself, basically, is what they're going to do to you.
Right. So we can expect that the people or countries who belong to the WHO will face the same nonsense that we faced here in America in 2020, 2021. They still advocate for those policies such as lockdowns and vaccine passports. So all those countries, they're going to go through the same nonsense. They're going to destroy their economies. They're going to damage their populations with experimental shots. And so, yeah, I feel very bad for those countries, and I would urge them to get out while there's still time.
Get out while there's still time. What about the quarantine camps anything in there that would allow them to take you and quarantine you against your wishes?
There's nothing explicit in there that mentions that, but it wouldn't surprise me that they'll try and do that regardless, particularly for a very high, for an infection or virus or pathogen or bacteria with a high fatality rate. It wouldn't surprise me that they would try and actually do that in these states.
What pandemic are you expecting them to release next?
It's appearing to be more and more, as time moves on, is H5N1 bird flu, right? We have seen that as the most talked about in the media recently. They are very much pushing that as the next pandemic. Peter Hotez and Robert Redfield, former CDC director, they continuously say that avian influenza will be the next great human pandemic, is what they call it. But we also have to understand that they do have modified versions of H5N1 in laboratories sitting in freezers. They've been modifying them for decades, and they could just simply release them from these laboratories and start infecting humans at high rates. There is currently a circulating form of avian influenza, but it has, in the past few months, died out. There hasn't been really any human cases in the past few months. And so it wouldn't surprise me if they do try and release another modified version of it. But there's also other viruses, bacteria, and fungi that they do have modified in labs, not just H5N1, but many things that we haven't heard of. They have Ebola, they have Marburg viruses, and it wouldn't surprise me that they have pandemic-ready versions of these. So I guess what needs to really happen is a complete clean-out of these laboratories, a coordinated international campaign to literally go into these biolabs, many of them undeclared and unknown to the public, and destroy these modified pathogens before they create another human pandemic.
Indeed. All right. Now, your boss, you run the McCullough Foundation, correct? Your boss was up on Capitol Hill last week. Here's what he had to say. Listen to this. He went viral, right?
Now, the topic today is myocarditis or heart damage from the COVID-19 vaccines. I'm a cardiologist. I know the topic well. I've examined thousands of patients with this problem. Thousands. Before the pandemic, I had 2 patients ever with this problem. There's 1,065 papers in the peer-reviewed literature on COVID vaccine myocarditis. So let me summarize them for you. The first one that came on my radar screen that was alarming came from Washington University in St. Louis, August 18th of 2021. The first author is Verma and colleagues, New England Journal of Medicine. 42-year-old man comes into Washington University Hospital with vaccine myocarditis. The infection is ruled out. It's the vaccine. He's in the hospital. This is one of our best hospitals in the United States. He dies 3 days after taking Moderna. They can't save him in the hospital.
Say, Dr. McCullough, move the microphone just a little bit away from you.
Then one was reported from Korea by Choi and colleagues. This is now a younger man. Just a few days after Pfizer, he comes in the hospital. He dies within 8 hours of being in the hospital. I can tell you, I'm a cardiologist. That doesn't even happen with heart attacks. He dies within 8 hours. I examined all of the slides and the images that the Koreans had showed us. It looked like somebody took a blowtorch to that heart. It was so completely fried with inflammation. His heart was destroyed. These cases, which were widely known at the time, should have gotten everyone's attention. Everyone should have been laser focused on this. We should never have someone die after taking a vaccine. That's directly caused to the vaccine. Then Gill and colleagues, Connecticut, published in Archives of Pathology, 2 boys, age 16 and 17, who die a few days after taking Pfizer. These are teenagers. They're found dead at home by their parents. They're absolutely horrified.
There you go. I mean, that went viral last week, didn't it?
I did. That went absolutely viral. You know, it was all over X. And even it reached the mainstream news, it reached Fox News. And so Dr. McCullough did an absolutely fantastic job testifying at this hearing. Senator Ron Johnson as well. Absolutely fantastic job putting this together. And the team at Daily Clout, Naomi Wolf, did an absolutely fantastic job with the preparatory work, the background work that went into this. And so, yeah, Dr. McCullough laid it out. He laid out that myocarditis is indeed fatal, right? It does kill people, and there's still no black box warning on these products saying that they can cause death, despite, and Dr. McCullough cited our autopsy paper, a systematic review of autopsy findings in deaths after COVID-19 vaccination. He cited it on the record in this testimony that we found 73.9% of deaths after COVID-19 vaccination looked at autopsy were due to the vaccine, and a causal link between COVID-19 vaccination and death. And again, still no black box warning, still no class 1 recall, which applies to products that can cause death. And so he laid this out for the whole world to see that these products can cause death. And so we hope that this is going to create a chain reaction to where people finally are starting to pay attention of their true harms.
Here's another one by Dr. Peter McCullough. Here we go.
The first time I testified at Homeland Security and Governmental Affairs, before a word came out of my mouth, Minority Senator Gary Peters said what America was about to hear was misinformation. I didn't even know what he was talking about. I had never heard that term before in academic medicine or in important deliberations. That's November 19th, 2020. What was he doing? He was using an old communist propaganda technique. He was attempting to gain leverage over me before a word ever came out of my mouth. We should never have our public servants ever try to gain leverage over anyone who is coming to Washington to help the nation on an important issue. The first time I testified.
100%. 100%. Well said, Dr. Peter McCullough. All right, what else are you watching? And you want to comment on that? And then what else are you watching, Nick?
Yeah, well, he's right. Misinformation is a propaganda term employed to gain leverage over others, and it's truly it's a word that has not been used in medicine before 2020, and then all of a sudden when they employ the psychological operation campaigns, that is a discriminatory term that makes people look inferior, and so that is a word that should never be used in science. Right. There is no misinformation in science. We're always learning. We're always changing what we know. And it is a shame that that senator did use those words in an attempt to discredit him. And Dr. McCullough completely destroyed him in his response. But in other news, we do have now today, we did receive confirmation from RFK that they are pulling the COVID-19 vaccine recommendations for healthy children and healthy pregnant women. So we do have some positive developments. But regarding that, I want to say it's not enough. It's not enough. And I'll say that because they will still be recommending the mRNA shots for what they call unhealthy pregnant women and high-risk infants. So they will still be giving them to those a 6-month-old with diabetes. So, we got to go further.
Indeed. Here's that announcement by RFK Jr. Listen to this, folks.
Hi, everybody. I'm Robert F. Kennedy Jr., your HHS Secretary, and I'm here today with NIH Director Dr. Jay Bhattacharya and FDA Commissioner Dr. Marty Makary. I couldn't be more pleased to announce that as of today, the COVID vaccine for healthy children and healthy pregnant women has been removed from the CDC recommended immunization schedule. Last year, the Biden administration urged healthy children to get yet another COVID shot despite the lack of any clinical data to support the repeat booster strategy in children.
That ends today. It's common sense and it's good science. There's no evidence healthy kids need it today, and most countries have stopped recommending it for children.
We're now one step closer to realizing President Trump's promise to make America healthy again.
Produced by the U.S. Department of...
Well, there you go. That is some very good news. All right, closing comment, Nick?
Yeah, that's great news. And we're making many positive strides in the right direction. And we are making positive strides in making America healthy again. But we do have to address the elephant in the room, which is mRNA shots, which will still be being given to a majority of the American population, which are labeled as high risk. So we have to go one step further, but we are going really, truly in the right direction.
Indeed. Take a look at his Twitter account here, X. Here it is, Nick Hulscher. You can follow him there. And then you can follow him on, it's at Nick, N-I-C, Hulscher. And then, of course, you can follow at McCullough Fund, at McCullough Fund. And you can also go to thefocalpoints.com, thefocalpoints.com. More cutting-edge information from Nick. Nick, as always, thank you for being with us.
Thanks for having me.